Nursing care of patients with upper G disorders, anorexia. Let's start with anorexia, not the psychiatric disorder, but the general loss of appetite. Causes include unpleasant food odors, certain medications, stress, psychological issues, and infections. Prolonged anorexia. That's a red flag. It can lead to electrolyte imbalances and dangerous cardiac arrhythmias. As nurses, we need to monitor intake and output, watch vital signs, track weight, and check electrolytes and ECGs. Encourage patients to eat their favorite foods and adjust feeding routes if necessary. Nausea and vomiting. Nausea is that awful, queasy feeling that you might vomit. Vomiting, on the other hand, is the body's way of getting rid of something harmful. Causes can be as mild as a virus or as serious as a heart attack or uremia. If vomiting persists, it can lead to dehydration, electrolyte imbalance, and metabolic alkalosis. Watch out for coffee ground emesis that could signal a G bleed. Interventions include protecting the airway, administering fluids, using antiemetics, and possibly inserting an NG2. Obesity. Obesity is defined as being over 20% above ideal body weight for waist circumference. It's risky when it's over 35 inches for women and over 40 inches for men. BMI over 30. That's obesity. Comorbidities include sleep apnea, heart disease, type 2 diabetes, depression, and more. Nursing interventions. Promote a healthy diet, physical activity, behavior therapy, and, for some patients, bariatric surgery. Bariatric surgery complications. These can include dumping syndrome, heartburn, gallstones, and vitamin deficiencies. Post-op, patients start on clear liquids and gradually advance to regular food over about 6 weeks. Weight loss is significant within 6 to 8 months, and follow-up is crucial. Psychological support may be needed, especially for body image changes. Oral health and inflammation. Oral care is often overlooked, but it's essential, especially in older adults, to prevent pneumonia. Watch for after stomatitis canker-sores, which can be triggered by stress or nutrient deficiencies. Cold sores, caused by herpes simplex virus 1, can be treated with acyclovir. Oral and esophageal cancers. Oral cancer is often painless and caused by alcohol or tobacco use. Esophageal cancer often isn't caught until late. It may cause difficulty swallowing, chest pain, and weight loss. Treatment might include surgery, radiation, chemo, or stents to help with swallowing. Pre-op care. Address lifestyle factors. Post-op. Maintain airway, support nutrition, and consult speech therapy for swallowing concerns. Hiatal hernia and GERD. Hiatal hernia happens when part of the stomach slides up into the chest. It's more common in smokers, pregnant women, and people over 50. GERD, or acid reflux, is the backward flow of stomach contents into the esophagus, often due to a weak les. Signs include heartburn, regurgitation, and hoarseness. Treat with lifestyle changes, like elevating the head of the bed, avoiding trigger foods, and using antacids, PPs, or H2 blockers. In severe cases, surgery fundoplication may be needed. Barrett's esophagus and esophageal varices. Barrett's esophagus is a complication of GERD where the esophagus lining changes. This is precancerous. Esophageal varices. These are dilated veins that can rupture and bleed, life-threatening and seen in liver disease patients. Gastritis. This inflammation of the stomach lining can be acute, chronic, autoimmune, or stress-related. Symptoms include pain, nausea, bloating, and belching. H. pylori is often a culprit. Treat with antibiotics, PPs, and lifestyle changes. Peptic ulcer disease. This is erosion of the G lining, mostly due to H. pylori or NSAID use. Gastric ulcers hurt 1 to 2 hours after meals. Duodenal ulcers hurt 2 to 5 hours after. Treat with antibiotics, PPs, H2 blockers, and lifestyle modifications. Sucralfate can protect the stomach lining. Gastric cancer. This is often diagnosed late and has a poor prognosis. H. Pylori is a known risk factor. Signs include weight loss, nausea, melena, and anemia. Treatment may involve total or partial gastrectomy, chemo, and biological therapy. Post-op, watch for dumping syndrome and nutritional deficiencies. Patients will need B12 and folic acid for life. Nursing priorities summary: assess and manage pain, hydration, nutrition, and bleeding. Educate on medications and diet changes. Monitor for signs of complications. Support mental health and body image as needed. Always consider infection control and aspiration precautions. That wraps up upper G disorders. Keep in mind early recognition, supportive care, and patient education are vital in upper G disorders. Stay sharp and always connect the symptoms to the patho.